Hi everyone. So we've just gone live for our third Facebook Live session as part of the MSc Public Health programme. So my name's Emma Bird and I'm part of the Public Health teaching team. And today I've got with me one of our esteemed MSc Public Health alumni, Nasrul Ismail.
Yeah.
Hi Nasrul.
Hi Emma.
So following on from last week's session with Janet, we have planned a few, we thought it might be useful to kind of talk to another student who's been through the programme, and Nasrul's got a bit of a different experience to Janet, so again trying to give you a bit of a flavour about the types of things and backgrounds that people come from. So firstly I'd like to welcome Nasrul and to ask him just if he could tell you guys out there a little bit about his background, where he's come from.
Oh, hello everyone. My name is Nasrul Ismail. I'm a former student of the MSc in Public Health at UWE. I am currently working at South Gloucestershire Council as a Public Health Commissioner. I come from Malaysia, but I have been living in Bristol for 13 years.
Excellent, great. So as you can see, Nasrul has more of a UK background than compared with Janet from last week. And one of the things I wanted to mention is that you are very welcome when you're watching this to ask us any questions. So if there's anything specifically you've thought about that you would like to talk to Nasrul about, please do write your questions down in the comment box and we will try to address those as and when they come through. Okay, so Nasrul, when thinking about your application to come to UWE to study the MSc Public Health, can you tell me a bit about what led you to that decision, and also what made you think, I'm going to come to UWE, this is my place to be?
Right, okay. In terms of the decision of doing, going into doing the MSc in Public Health at UWE, I was actually at South Gloucestershire Council at the time, very new, probably about 4 or 5 months. And then the specialist public health manager said to me, she said, if you want to do this master's, there's a place we can nominate you through the Director of Public Health. Okay. And then I said, okay, let's think about it first. When I, at that time, the area that I commissioned, drug and alcohol, it sat within a crime reduction team of the council. At that time, it just got transferred into the public health department. So I thought, okay, what had got me this far was the skills and the experiences that I had from the previous workplace. But in order for me to know about public health, being able to articulate, say for example, social determinants of health, or the systems thinking in public health, that drug and alcohol doesn't sit in isolation, but also looks into other areas of work, then I think I definitely need some education behind it, and as well as the tools to be able to do it. So I thought that the course would provide me with the accelerated learning of the public health. I have been public health commissioners for many years, so I think it would be good for me as well to broaden my horizon and learn about the public health business in general. For example, smoking cessation, tobacco control, dementia, emergency preparedness. So the modules like the epidemiology for non-communicable diseases and the health protection model definitely helped me kind of like learn into that, what is it called? The public health business. The other thing that I was looking when I made the decision was that around the career progression. I have been more involved in the recruitment process within the council. And one example that really stuck in my mind was actually when I was involved in shortlisting for a post, I think it was an evaluation officer post. Okay. Normally we would get probably about 30 applications, but at that time we had probably about 120 applications. Oh, wow. So yeah, so that we thought that, in order, because these are all very qualified people, so what we had to do then was actually to shortlist people just based on the qualification, which means that we would only shortlist based on masters or PhD in public health. Okay. So that really opened my eyes, and I thought, okay, masters in public health will be a worthy investment.
Absolutely, and I think that's something that we've heard more and more about, is that when people are going for jobs, there is more of an expectation now. If you want to progress, you've got to have that master's qualification at least to almost be able to move up the ladder.
Definitely.
In the workplace. So that's really interesting to hear that from your perspective as well. And obviously, because you came from a local authority nominated place, UWE was probably, I guess, the option you had.
Yeah.
Did you have any sort of preconceived ideas about UWE before you came?
I didn't actually. I didn't have any preconceived kind of like idea about UWE, whether it is a good or not so good provider of the higher institution. When I was presented with the opportunity, that opportunity came from the Southwest Public Health Workforce Development Steering Group. I didn't have any choice, as you said. Apart from UWE, I couldn't apply. Like Janet last week, she mentioned about having applied to 20 universities across the 2 years. So yeah, I didn't have that option. But I thought when I did some kind of like, kind of like looking into UWE as a provider, having spoken to some of the colleagues who had completed the course, I knew that, definitely UWE is definitely a good provider for public health course, MSc course. At the same time, I also kind of like preferred the flexibility that the course provided. I live in Bristol. I work
Oh, it looks like we're back live again. You just paused because we think there was a poor connection.
Yeah.
But yes, just interrupted you slightly there, thinking about the flexibility of studying in a Bristol location.
Yeah, definitely. So as part of the arrangement, they said that I would be released for a day a week. So it just made sense to be studying in the city where I live and work in.
Absolutely.
And also there's an option that I took advantage of, which is kind of like the fast track, where I completed my dissertation, which was supposed to be in year 3, in year 2.
Okay, yeah, so you actually managed to complete before schedule, ahead of schedule.
Yeah, definitely.
Which again is something that when you join us, you can actually think about when, depending on how your studies are going, you can always discuss that with any members of the team in terms of what you might like to do to fast track what you're trying to work towards. Great. So can you tell us a little bit about your experiences of when you were actually on the course? So it would be great to hear about any positives, but equally, please feel free to tell us about anything that you found challenging or more difficult to sort of overcome while you were here.
Okay, in terms of the positives, I think the course, had been overwhelmingly positive. I'm not just saying that because you are talking to me at the moment. I think what really interests me was that the applied nature of the research and teaching that the students like myself gain from the course. All of our lecturers are actually active researchers in the community. For example, yourself and Professor Jean Powell lead in physical activity, and then we have Dr. Nick DeViciani, who leads in prison, Stuart in terms of migrants' health, and Alexander Technic in pain management. So their research informs the teaching and vice versa. So I think that is really useful. The other thing was that it is about the applicability of what I learn in the classroom and what that I can apply directly into my work. For example, being a commissioner of drug and alcohol service before, modules such as health promotion, policy and politics, and public health economics really helped me out in terms of my work. For example, in health promotion, we learn about the assets-based community development. So because we commission a lot of voluntary and community sector organizations, so as a commissioner, it would be important for me to appreciate the assets that we have in the community and how the community can organize themselves in providing the health interventions within the community setting. For policy and politics, I learned a lot about the new public management around payment by results and the performance structures that may impact the delivery of voluntary organizations. And in terms of public health economics, I was able to articulate the difficulties in evaluating the effectiveness and cost effectiveness of intervention.
Yeah, tricky.
Very tricky. And also being able to articulate to the decision makers, like my managers, the director, and the elected members, that cost effectiveness is not the sole determinant of making a decision. We need to be able to look at wider range of interest to come to a commissioning decision.
Absolutely. And you've just given a very good pitch for your level of knowledge about all the different modules, even though it was a little while ago now. It's really impressive.
Thank you.
And it's also worth mentioning that Nasrul has been a really active sort of participator with the course, and has very recently had his work that he completed for the Public Health Economics module published. So the work that he submitted towards that has now been published, which is just a really fantastic achievement. And I think it kind of demonstrates really how within the course we try to have, we try to teach about the theory, but actually we try to relate it a lot to practice as well. So it does have that applicability in the real world.
Absolutely.
It's very important to us as the team. So that's great to hear that it's working out that way.
Thank you.
And so moving on to challenges, were there anything that you found really tricky to deal with, or anything that we could have been thinking about differently that you came across when you were in the course?
I think having come from a law and criminal justice background, which is not a traditional public health background at all, I think I really learned a lot how to adapt my thinking and the way of writing and speaking using public health principles. I remember the very first assignment that we had, it was on Introduction to Public Health module.
Yes.
So at that time it was an exam. I believe now it is a coursework. At that time we had this practice essay. So I did that practice essay under the exam condition and submitted my work for feedback. And then it was Professor Selina Gray who marked my paper. And then when I got the feedback, I was like, every single paragraph got some comments. You have to avoid flowery language. You have to avoid complicated language. Make your essays more structured. I was like, whoa, this is so, where did this come from? But that was brilliant because like I learned from it, and her comments definitely made me think a lot about, the future assessments. So that definitely helped me out a lot. The other thing was, I think everyone within the course will face this kind of challenge, which is the fact that some of the modules would come more naturally to us compared to some others.
Absolutely.
So modules like health economics or health promotion would be, this is very near to me.
Yes.
But there are modules that I slightly struggle with, for example, health protection, because that has like some sciences elements to it, and I come from a social science background, but it's just that just having to kind of like make sure that I just put a lot more effort into it, and if I didn't understand anything, one of the tutors or lecturers would definitely be happy to help out.
Excellent. And as a part-time student, something that is interesting, I guess, again, comparing yourself with Janet's experience, was there anything about taking the course part-time that was that you found kind of useful or maybe was difficult at times?
I think doing it part-time definitely helps because as part of the agreement that I have with my employer, they would release me 1 day a week. So that definitely helped in terms of keeping the job and being able to study at the same time. It also came with challenges, for example, in terms of the preparation or, for the coursework or exam, we had to do it over the weekend or in the evening, or we had to take some annual leave.
Yes.
But, with any arrangement, I think there are pros and cons. But definitely working in tandem with studying definitely helps in terms of that application of what we learn in the classroom into work.
Absolutely. And it's worth noting as well that we have a real range of options that people undertake when they come to do their master's. So we have some like Nasrul who end up doing part-time study, so 1 day a week, and then work sort of in their own time after their working week. Then we also have some who work alongside the masters but are doing the masters full-time as well. So they might have maybe reduced hours compared to the experience that Nasrul has. So even if they were studying full-time, there is that opportunity to be having some sort of part-time role alongside. And then, of course, we've got people who come and do the full-time programme and have very minimal opportunity, or not opportunities, minimal hours of different types of paid employment. So there are really different options available to you, and it's really whatever suits you seems to be the thing that helps. So we have a question from Regina. Hi, Regina. Hi, Nasrul. Sorry, I think I missed your introduction. What did you say your job was? Can you just recap?
Yeah, hi, Regina. So my job, I work as a public health commissioner at a local council in Bristol, and I have been working for 10 years within this field, and I have lived in Bristol for 13 years. Great. So that was my background. Yeah.
Okay, so we'll maybe just pause for a moment just to see if anyone else has any questions at this point. Just give you 30 seconds to type anything in. I think they've just been blown away. Nasrul, they're so impressed. Okay, so we'll just move on to onto some other ones of our questions. But as I say, if there's any point you want to add anything, if you've got any specific questions, I'm sure Naz will be really happy to answer those. So moving on now to think about, since you finished the course, since you graduated, what have you been doing since you finished?
Okay, I just finished my course back in January, February time. So since then, I was promoted to public health program lead position at South Gloucestershire Council. It was a temporary promotion as my line manager got a job somewhere else. Since then, I have been looking into the opportunities to publish the work that I have been doing as part of the course. So together with my dissertation supervisor, Dr. Nick DeViciani, we had submitted a couple of papers which are currently under review. Yeah, and also I have been able to attend a couple of conferences to present the findings from my dissertation, one in Amsterdam last year, just after the data collection process, and recently, a few weeks ago, in Telford.
Great.
Yeah, thank you.
Fantastic.
Yeah, thank you.
So you've managed to really get into the research side of public health as well. You're starting to really enjoy that, which is lovely.
Definitely.
And how about now? I think there's some news that you've had recently that you can talk about.
Definitely, yeah. So basically, I was awarded a 3-year scholarship to do a PhD at UWE by the Economic and Social Research Council. So the topic of my PhD would be around understanding the impact of macroeconomic austerity on prisoner health and well-being. I was lucky that this research would be supported by 11 organizations, for example, the WHO Health in Prison Programme, the Department of Health, Public Health England, voluntary organizations, and mentorship from a couple of leading academics in prison field in the UK. So I think, yeah, it was. I'm still surprised, to be honest, to have been awarded that scholarship. You know, out of those 200 people, I got picked. But I think, that is kind of like the testament of how well this program prepared me to go into academia and PhD research, and it wouldn't have been possible without this MSc in Public Health program, nor the support that I received from many amazing tutors at UWE.
Oh, well, that's very kind endorsement for the program. And we should also mention that actually most of that is down to Nasrul being a really fantastic student, and he went through such competitive. Back on.
Okay.
So I was just saying that Nasrul, is very, very kind about the course, but also has worked really hard to get this opportunity. So just can see we've got a couple more questions. Hi, Paul. So Paul's asked, what good things can you tell us about Bristol?
Good things about Bristol. Interesting question. Never thought of that question before. I think in terms of the location, I've been living in this city for many years. I think it is close, proximity to other cities. For example, London, Cardiff. In fact, for my, dissertation module, I had to travel quite a lot to go to, the participants in London, in Reading, in Leeds. So Bristol is definitely central, and it is quite close to other cities as well. So I think that's a good point about it.
Excellent.
And I think Bristol Bristol had been voted as the best city to live in.
Yes.
In the UK this year. So I think, that's definitely a plus point. So yeah, yes. I think it is a really good city, and I don't think I have any plans to move out of Bristol and in the near future.
And that is definitely the right answer.
Yeah.
Thinking about Bristol, as a very proud Bristolian myself, born and raised here, so I can definitely agree.
Yeah, cool.
That it's definitely the best city in the UK to be living in at the moment. And we've had another question. So from Regina again. So how has the MSc helped you in your current job? So obviously you're sort of in a bit of a transition period, but maybe thinking specifically about your time in your local authority role, how do you feel that it helped in that particular role?
Thanks, Regina. In terms of how this MSc helped me in terms of my work at South Gloucestershire Council, I have been able to, for example, appraise articles that have been published, through the modules, for example, the qualitative and quantitative health research. I have been able to undertake robust evaluation and complete robust needs assessment, have equity audits, that kind of like documentation in terms of what works and what doesn't work in my area of work. I've also been able to appreciate how the key global issues, for example, things that happen in Africa, for example, Ebola and Zika, and how that impact our travel plan, that kind of application, and also have been able to kind of like speak to the decision makers about how certain evaluations do not lend themselves in terms of the cost effectiveness, and that we need to look broader for broader metrics in terms of commissioning decision. So that kind of application, really.
Excellent, great. So that it does really sound like the sort of modules and things that you've been taught have linked quite well with your role at the moment. So one of the final things I wanted to ask you about was your future plans. So we know that you're going to be starting and joining us in October to start your PhD, which is really fantastic. So obviously you've got that coming up, but is there anything in the kind of more, maybe 5 years from now or 10 years from now that you can kind of see yourself doing?
Yeah, okay, good question.
So
so I think after I complete my PhD, which is hopefully around this time, in 3 years' time, 2020, I wish to apply for a postdoctoral research funding from the current sponsor, which is the ESRC, for a couple of years to do some research, and hopefully after that try to apply for a permanent position at a university, hopefully UWE, but anywhere would be fine.
Excellent. Well, that is really exciting news for us. That's great.
Yeah. Question.
Oh, another question. Yes. So you mentioned that working with South Glos Council, do you think it would be straightforward to find jobs overall there once the program is finished? That's a good question, actually.
Yeah.
Because that's something that you'll probably have a good bit of insight into.
Yeah, definitely. So I think working, finding jobs after we graduate, I think it really depends on how much experience that you have. What my advice is that trying to kind of like be really active member of of the course. There are various opportunities, for example, working with Public Health England or the local authorities as part of the placements. That is something that I would really encourage you, so that you can get some flavor of the work and see whether you like working in that environment. And also, in terms of the jobs, I think it doesn't have to be only local authorities like South Gloucestershire Council. You can also apply for civil service jobs. There is also a training scheme to become a specialty registrar as well as consultant in public health. And also something that people have not talked about is actually working within the third sector, the voluntary and community sector organizations. They are the ones who work in the community, kind of like mobilizing their resources to improve the health of the population. So that is something that perhaps can be explored as well. So in terms, to answer your question again, how easy or straightforward it is to find a job, I think it really depends on the opportunities available at that time, as well as the experience. But make sure that you take all of the opportunities available to prepare yourself for the job market.
Yes, I think that is a really good piece of advice, and it's something that we really do try to encourage as students go through the course. So, for example, as I think we talked about in our first Facebook Live session, that we do have opportunities for placements while you're on the course with people like Public Health England or different local authorities. And some of the other things that we do is we highlight where there are opportunities with third sector organisations. So here at a university level, we have a volunteering sort of hub that gives you lots of information about different volunteer roles that are going on around Bristol and the local area. So even though you might not hear the name of the organisation and think, oh, that's public health, what we can do is we can tell you a little bit more about those organisations and say, well, actually, this is how it links to public health. So you can get that experience and you can go out there and maybe do something that's not traditionally what we might think of as public health, but it does have a really important role within public health. So there are definitely lots of opportunities. And I think from the last few years of learning about the student experience, is that something that we do really encourage, is that active participation with the course, and not just coming along to the module sessions, but also trying to do these additional things like get your experience boosted while you're here as well, as you can do.
Yeah, definitely. Yeah.
Oh, and another question from Regina. Are the opportunities only based in Bristol? I would say no.
No, definitely not. Yeah, no, definitely not, because I have, as part of the course, you meet, people from Nigeria, people from Canada, and also people from, across the UK. So the opportunities are not just in Bristol. Bristol would be kind of like probably the most logical place to be, since we are all based here. But I have colleagues who have relocated to London to do the public health training scheme. I have colleagues across the Southwest region and around Midlands working with voluntary organisations and civil service. Some of them have gone back home to serve for their government. So yeah, the opportunities are just not just in Bristol, but kind of like the whole world, really.
Yes, absolutely. And I think it's again, it depends on your own circumstances. So if you are planning to come to Bristol from a long way away, then it might be that the easiest thing is to get some work experience in Bristol or to base yourself here. But if, for example, we have a number of students that come up from Cornwall in the southwest to take the course, and yet they are, they're living and working back in Cornwall, and they basically just come to Bristol for their study, and they do all their own work experience and things back down in Cornwall. So it's really whatever suits you as the individual and what you're trying to achieve, I guess.
Yeah, definitely. And also I would like to add the fact that this course has actually produced a lot of credible alumni. For example, the Director of Public Health in Bristol, Becky Pollard, and the former Director of Public Health in Wiltshire, Maggie Ray. So in terms of their career trajectory, I think they have done really well. So that hopefully that can be your inspiration, really, in terms of working in the UK and also abroad.
Yes, absolutely. And I think that is a really great point from Nasrul there, thinking about career progression. He's absolutely right that the Directors of Public Health almost across the whole of the southwest are people who have been through our public health course. So it's almost like this could be your starting point, and you can just go on and on into the future depending on the type of role you might want to go into.
Definitely.
And we also have tried to keep those links with those Directors of Public Health. Some of them come in and teach on some of our modules, and again, that's where our links come with some of the placements that we have. So it is a very nice community, I guess you'd call it.
Definitely.
Linking with the Directors of Public Health and with the programme core team.
Definitely.
Great. So I think that's probably everything that I was thinking of asking you about. Was there anything you wanted to add at all?
I don't think I have anything to add,
Okay.
but I would just, like to say that my experience has been overwhelmingly positive, and I have been recommending this course to my colleagues. So yeah, I think it is really good course that prepares me for my career progression, as well as for the future development, really.
Great. Oh, well, thank you so much, Nasrul.
No problem.
So what I will just do is ask, are there any final questions from anyone who is logged in? We'll maybe just have, again, another 30 seconds. Just type any questions in that you might have before we leave you today. So I think this session will be really good for people watching back as well, because you've given really helpful information. Actually, it's been fantastic, really useful.
Great. And I'll be happy to answer the questions if people watch this at a later stage.
Ah, great.
And then, yeah, feel free to comment.
Brilliant.
Yeah,
that's great. And so if you do, if you aren't watching this live and you're watching this later on today, please do add some questions to the bottom. Oh, we've just got another question from Janet. Then yes, please do write any questions here, because we get alerted anytime anyone asks a question. So even if it's sort of 2 days down the line or a week down the line, please do feel free to ask any questions. So it looks like Janet's just got in there in time. So Janet's asking what your future plans are. So I know you've touched on this a little bit, but maybe just a little recap would be really useful.
Yeah, over the next 10 years.
I know.
Okay. Yeah. So hopefully I will complete my PhD in 3 years' time, and then I would apply for a postdoctoral funding to do research for a couple of years from the current sponsor, which is the Economic and Social Research Council. And hopefully after that, hopefully I can position myself as an academic within a university. Hopefully I'll be able to apply for a permanent position then. So we'll see.
Excellent, good. Nice positive plans for the next 10 years.
Yeah.
That's quite a hard question, I think.
Yeah, definitely, yeah. First I need to be questioned.
Great, okay. So it doesn't look like we've had any more questions, so I think we will assume that is everything for today. But as I mentioned, please do add any questions if you're not watching this live, for myself or for Nasrul, or again any for Janet or Paul, who took the session last week. We will also be in touch when we are putting together our next session, and in the meantime